I think when if we think back over the last few years, there's been so many changes in offerings for patients in terms of treatment. And so this has been a massive difference for doctors, right? About, oh my gosh, there's so much more information we need to know to treat CLL than we ever have in the past. I think you also have to understand for patients, this is a new and very different world, and things have changed considerably. And if doctors are thinking to their own maybe some struggles or not necessarily from a comprehension perspective, but just from a vastness of information perspective, what you have to do to keep up. Also thinking about those patients and all of this new knowledge that they're also learning that perhaps you didn't have to think about in the past. So really using terminology that you would use in other places. So don't stray away from using terms like minimal residual disease or stable disease or treatment holiday or any of those terms. Use them, but explain them. And the reason I'm suggesting that you actually use the terms is that they're getting tossed around on patient boards. Patients are hearing them in other places. So let's make sure they actually understand those real terms. And everything takes time. And I realize sometimes time is a limitation, and whether you have capacity to explain things well to a patient. But if you don't have that kind of capacity from a time perspective, then please direct them to somebody else. So direct the patients to a patient organization, to somebody else in your team that perhaps has more time to explain things for them. Send them to really good websites. I know the internet's full of good and bad, but that's why we need to direct them to good sites. Give them something that's written. Give them lots of different ways that they can explore and find the information themselves, and then do a check-in with them to make sure what they've learned is actually accurate and matches how you were using the term in their particular case. Because sometimes, these terms are new and they think they may have a good idea, but by the time they really understand the term, they've forgotten the context of the sentence that you used it in originally. So always going back and making sure they understand this new terminology in the context of their own disease. So those things are definitely helpful. I will also say, if you're going to, or you think that the nurses perhaps in your clinic are the ones who are doing a really good job educating those patients, please go back and check with them that they're doing it. Sometimes there's even that disconnect, and you think something's happening in a clinic that isn't. And if you're struggling to find local patient organizations or good material, there is lots out there. So check in with people you do trust, who can help direct you. There's a list on Lymphoma Coalition's website of member organizations around the world. But there are lots of ways that you can find that information, even from colleagues. Perhaps you have some good resources and are willing to share.